Hello everyone, and welcome to Restorative Health Solutions. If you understand what's making you sick, then you can start to understand how to get better. More information is power.
Hi, I'm Dr. Paul, and today we're going to talk about our functional medicine approach to SIBO, or small intestinal bacterial overgrowth. As a reminder, SIBO is when we have bacteria in the colon or large intestine that work their way up into the small intestine, contributing to bacterial overgrowth and causing symptoms. The functional medicine approach to SIBO is to get to the root cause and then put together a personalized plan that consists of an individualized diet, lifestyle modifications, and a supplement protocol that may consist of herbs, certain types of probiotics, vitamins, minerals, essential fatty acids, antioxidants, and amino acids. We are able to personalize the diet and supplement protocol by doing comprehensive, thorough testing on each patient. Another condition that can look very similar to SIBO is irritable bowel syndrome, or IBS. So are SIBO and IBS the same thing? Although SIBO and IBS definitely overlap and have some similarities, there are distinct differences between the two. In SIBO, we have the bacterial overgrowth in the small intestine that can contribute to symptoms. Some common SIBO symptoms are bloating and gas, especially after eating, abdominal pain, constipation or diarrhea, heartburn, indigestion, nausea, fatigue, brain fog, malnutrition, sense of fullness after eating, and more. The gold standard test for diagnosing SIBO is the breath test, although there are questions on how reliable it is. Whereas in IBS is a functional condition without a known cause that can contribute to symptoms such as bloating and gas, abdominal pain, constipation, and/or diarrhea, but there is no test to diagnose IBS. Before we can start addressing the SIBO, we have to ask some very important questions. The most important question of them all is, what causes SIBO? Here are some common causes of SIBO. Low stomach acid or hypochloridria. Stomach acid is your great protector that helps kill microbes or bacteria that are in your saliva or on your food. If you don't have enough stomach acid, some of these microbes, including bacteria, can work their way down into the gut and contribute to overgrowth and symptoms. Chronic PPI use can be one reason for low stomach acid. Next on the list is a dysfunctional immune system, followed by antibiotic use. Antibiotics can wipe out a lot of the beneficial bacteria, which can then allow for opportunistic bacteria and other microbes to become overgrown, causing imbalance in the gut or dysbiosis. Next is slow motility or constipation, and the final one on the list is a history of gastrointestinal surgeries that may impact the stomach, small intestine, ileocecal valve, or colon. On a side note, one of the most common causes we see for recurring SIBO at Restorative Health Solutions is exposure to mold from water-damaged buildings. Another question we want to ask is, are there any risk factors with SIBO? Here are some of the more common risk factors for SIBO. Low stomach acid or hypochloridria, slow motility or constipation, a history of gastrointestinal surgery, diverticulosis of the small intestine, Crohn's disease, ulcerative colitis, radiation treatment to the abdomen, several chronic inflammatory conditions including celiac disease, diabetes, IBS, etc., chronic stress, and more. A lot of our patients have symptoms very similar to SIBO, and they want to know if they have SIBO or not. So, what's the best test for SIBO? With SIBO, it's very important to get accurate and thorough testing. As mentioned earlier, the gold standard test for diagnosing SIBO is the breath test, but its reliability is being questioned due to it being susceptible to having false positive and false negative test results. At Restorative Health Solutions, we use other tests to look at the whole clinical picture. We test several things, such as genetic testing for gluten sensitivity, food allergy panels, food sensitivity profiles, stool testing, organic acid or oat testing, nutritional deficiencies, adrenal or cortisol panels, and more. We know we cannot diagnose SIBO by looking at a stool test, but we can definitely look at different findings that may suggest bacterial overgrowth. The additional testing can really help us individualize the diet along with the supplement protocol. Remember, this is a one-size-fits-one approach, not a one-size-fits-all approach. Now that we've covered some common symptoms, common causes, risk factors, and testing for SIBO, we're on to the last step, which is our functional medicine approach to SIBO. This is a basic outline and can vary significantly from person to person, so as always, please consult with your functional medicine practitioner to see what approach is best for you. Step number 1, remove inflammatory or trigger foods. Step number 2, provide digestive support like stomach acid support, digestive enzyme support, bile support, if needed, based off patient symptoms and test results. Step number 3, provide support for the gut barrier or gut lining, again, very specific to the individual patient based off of history and test results. Step number 4, use antimicrobial herbs to help address the bacterial overgrowth. On a side note, we always want to make sure that we're having daily bowel movements before starting this step. Some common antimicrobial herbs used at this step are oil of oregano, berberine, grapefruit seed extract, olive leaf extract, and more. And step number 5, supplement with specific probiotics after finishing the antimicrobial herbs. Again, this can vary significantly from patient to patient. Using a comprehensive step-by-step approach based off of history, symptoms, and test results can significantly increase your chances for long-term success when addressing SIBO. Well, I hope you learned a little bit about our functional medicine approach to SIBO, and until next time, I'm Dr. Paul.